morning, everyone, especially those of us from the West Coast, regularly for us. My name is Ashley. Let's see. There we go. My name is Ashley. I'm a social worker. I'm also a patient advocate, and this is From Viral Videos to Vital Conversations. Before I dive into my diagnosis, I want to share a little bit of background, because as you all know, I'm so much more than my diagnosis, and all patients are. I live in Northern California. I'm the mother of 2 young boys. Before my diagnosis, I was a hospice social worker. I was always very active and very healthy. I was that person that would wake my whole family up on Thanksgiving to do the turkey trot at 6 a.m. No one actually enjoys doing that. I probably didn't either. Brewed my own kombucha. I was that fun person. I also don't have a smoking history. So I can spend hours and hours going through my diagnosis because I feel like my story is in the details. But for sake of time, we have 10 minutes. I'll go ahead and just share the bullet points here. So in the course of 366 days, I went in over 20 times pleading for help as my symptoms progressed. In the very first telehealth visit with my doctor, I told her and gave very compelling symptomatic reasons as to why I believe I had a tumor growing in my right lung. Instead of doing any further workup, I was asked, Ashley, do you have a history of anxiety? And Ashley, are you obese? Because this may lead to your shortness of breath. I told her I never knew that anxiety or having a BMI led to a stabbing pain in my back every time I laid down, but what do I know? And this paved the way for a year and 1 day of misdiagnoses, ranging from everything from long COVID, acid reflux, GERD, asthma, to pneumonia twice. My symptoms progressed to the point where I could not hold a pen at work because I had full body joint pain. My fingers were so clubbed, it was hard for me to hold a pen. I was utterly defeated, had just left urgent care, and this woman here, who is now my girlfriend, I had just met her three weeks prior, said, Ashley, nobody our age gets pneumonia twice, doesn't respond to medication or antibiotics unless there is an acute health issue. If you don't take yourself back to the ER and refuse to leave, I'm gonna drive up from Oakland and take you myself. So, not wanting to inconvenience her, I reluctantly asked my dad to take me to the ER. I refused to leave per her advice. She also said ask for an MRI or a CT scan, and that was the first person to say that to me in over a year. They told me what to ask for. I refused to leave, and thank goodness this doctor noticed my clubbing, my finger clubbing. I told her I was dizzy when I stand up, and I could go on, but I was diagnosed with a blood clot, a pulmonary embolism. I was later admitted and diagnosed with lung cancer. Because I didn't fit a profile, nobody, including all of the doctors and specialists that I saw, thought I would be at risk for lung disease. These biases often lead to delayed diagnosis as well as stage 3 and 4 diagnoses for young women who don't have a smoking history. This is one of the first videos I did on my TikTok page. And I think it highlights the fact that young women often can present as healthy, and we push through our symptoms, especially mothers, because we really have no other choice. So I will try to see if I can get that. My life was immediately turned upside down. I never imagined I would be telling everyone from my grandma to my 3-year-old son that I had lung cancer. The beginning is definitely a blur, but I remember 2 things very clearly. 1, I was told, Ashley, you will never be eligible for a lung removal because those are reserved for earlier stages. And 2, don't worry, this is your glimmer of hope here. You will have a biomarker. And we spent a whole conversation, felt like hours, talking about biomarkers. And my first question was, what is an EGRF? Can you explain that again? I'm very confused. So I was told I'd probably have an EGFR mutation, and this will give me a better quality of life and possibly a longer life. My reality turned out to be a bit different. I actually have no genetic mutations. And what this means is my treatment path will be unconventional. I have limited treatment options, and I felt like my glimmer of hope was lost. I felt like I was the only person in the world living with lung cancer, especially at my age. I remember going online, I could find no one young living with lung cancer. I actually don't think I found anyone old living with lung cancer either. This really amplified the isolation that I already felt and the stigma that I felt. It was very hard relating to my friends at this point who would talk about like Tinder dates gone wrong or workplace drama. I really could not relate to that at this point anymore. So 4 months into my treatment, the tumor was confined to my lung. I felt very strongly I wanted to get referred out to talk to a surgeon about potential lung removal. I asked for the most aggressive surgeons in my state. All refused to talk to me except for one. He did agree to move forward with a pneumonectomy and then later changed his mind. I was heartbroken, but very determined to still find a surgeon. So with the support of my new oncologist at a research hospital, I spent weeks and weeks reaching out to all of the top hospitals in our nation. I remember very awkwardly stumbling through my situation to the nurses on the phone, and it was the same conversation every time. They'd say, are you sure? This is very unconventional. Do you need oxygen? Are you on mobility assistance? Like, how are you even able to fly here? They would ask me to send all of my records and imaging over, which I did. It took hours and hours and hours to send these things over, only for them to refuse to meet with me because of my staging. Finally, I found a surgeon in Boston who agreed to meet with me face-to-face, but I did face significant barriers. I'm a single income household. I was on SSDI, still am. I was still undergoing treatment, immunotherapy, every 3 weeks and dealing with the side effects, like extreme fatigue from that. I have 2 children at home. I have no primary caregiver. No roadmap for this. I felt like I was going rogue. I also have privileges. I have impeccable health insurance that allowed me to travel and get these second opinions for 0 cost. I have family that could help me financially and help me with my boys. I have a co-parent that is nothing but supportive, and my girlfriend who has been a fierce advocate for me and journeying alongside me every single step of the way. Finally made it to Boston, and the surgeon agreed to do the lung removal. But she said, you know what, there's a surgeon really close to where you live in Oakland. His name is Dr. Vallada. I recommend maybe you talk to him first because it would be much easier to recover closer to home. So about 2 hours after I met with her, boarded the plane, a bit chaotic, doesn't matter, deboarded the plane, and I was already on the phone with Dr. Vallada. And 2 months later, I had a full pneumonectomy at Oakland, at Kaiser in Oakland. And in this case, I believe self-advocacy saved my life.